So as I said, welcome to the LRS virtual conference. This year we've obviously had to run with a very different format than usual, but we're pleased to be hosting 14 virtual and pre-recorded workshops throughout the month of November. The title for our conference this year is Building Resilience Together, supporting mental wellness, utilising physical activity and sport. We feel that it's important, and more so than ever at this time, to support the communities of Leicester, Leicestershire and Rutland, to look after their well-being, and we feel that physical activity and sport can play a huge part in helping them to do so. During the pandemic, the importance of physical activity has been reiterated by the government, with all of us being encouraged to, where possible, continue to lead an active life throughout. And in addition, there's lots of national evidence that physical activity can have a positive impact on mental well-being. Exercise is often described as a wonder drug in preventing and managing mental health. So we want to utilise this conference to raise the awareness of physical activity, sport and the links to the mental wellness agenda, and encourage our networks to champion this. So it's an opportunity for you to build your networks, as well as sharing your expertise and experience with each other. As I mentioned, it's also part of the workshop today, is also part of the Leicester Business Festival. So welcome to those that have booked on through LBF. There's lots of events this week leading up to Friday. So do take a look at the website there for more workshops. So today's workshop is going to focus on the value of health and wellbeing for businesses and organisations in Leicester, Leicestershire and Rutland. Hopefully you'll leave today's workshop with an understanding of the importance of supporting the health and wellbeing of staff and the resources available to do so. My name is Bryony Cornish. I'm a Sports Development Officer at LRS with a remit around wellbeing at work, and I'm joined by my colleague Ali Clements. I don't know if you want to wave, Ali, who's our Economy and Sport Growth Manager. So we'll be tag teaming this morning along with a couple of guest speakers. The agenda's up on the slide. We'll try and keep the timings tight so that we can finish promptly at around 10:50 a.m. this morning. So just briefly, for those of you that have joined through the Business Festival and might not know who Leicestershire and Rutland Sport are, we're one of 43 active partnerships across England. We're a partnership of local and national organisations working together to get people more physically active, with a remit of sport, physical activity, health and wellbeing across Leicester, Leicestershire and Rutland. A lot of our work is done through partnership working with local authorities, health organisations, community groups, sports clubs, and our programmes range from early years right up to older adults. Funding predominantly comes from Sport England lottery grants and by local and national partners, and we're part funded by Leicestershire County Council Leicestershire County Council Public Health Department. So we're going to kick off this morning with a quick poll. We just want to know, on a scale of 1 to 10, how confident you feel to be able to support staff health and wellbeing. It's just give us a bit of a gauge of where you are at on your journey with that. So hopefully the poll should pop up on your screen. If you are on a mobile device, I think sometimes it doesn't, but we'll give you some feedback on the results so that you can see that. I think the majority of you have voted.
Yeah.
Okay, so we can see that most people are sitting around the 6 or 7 mark, a few feeling a bit less confident, but majority sort of that upper end of that scale, which is really good.
Slight issue with the screen, bear with me. Clearly have to do something different with a poll. Yes, there we go.
So we're just going to set the scene a little bit now around health and wellbeing and the current picture across our local area and nationally.
So my chance is to sort of update you here. So the personal and financial benefits of improved workplace health and wellbeing prior to the COVID-19 pandemic was very well documented. But in the current climate, individuals and organisations have a renewed increased appetite for physical, social and mental well-being. And it's more important than ever that employees feel supported with their own health and well-being. we know that as an employer, improving the habits and behaviours of employees will support improvements in productivity and reduction in sickness absence, presenteeism and staff turnover. And in front of us here, we've got some stats that might be useful to you. So prior to the pandemic, 490,000 people were employed in Leicester and Leicestershire. That's 63% of the entire population. So if we're supporting that cohort of people to have improved health and wellbeing, that's really positive. 25% of our working week, that's the total hours of our working week, are spent at work. If you take off 7 hours a night for sleeping, actually it's about a third. So we do spend the majority of our time, or a big chunk of our time, at work. And there's some bigger stats on the screen in front of you, some of which you might have seen before, but some might be new to you. We're going to press on because we want to cover quite a lot of ground this morning. So got another poll for you. What is the most common reason for working days lost due to ill health? This is just a guess. So nearly everyone's voted, Bryony. So that's where our thoughts are for the day.
So there the results are. So we've got a top result for stress, depression, anxiety, followed by musculoskeletal disorders. And you'll see on the next slide that that's pretty much spot on. So as you can see on the figure on the left, 54% of working days lost are due to stress, depression or anxiety, and that's work related, followed by 29% of days being attributed to musculoskeletal disorders. That equates to around 0.6 million work-related stress, depression or anxiety cases in the period of 2018 to 19, and 0.5 million cases of musculoskeletal disorders. There's two factors here really which, if addressed, can have a huge impact on the number of working days lost due to ill health. In terms of musculoskeletal disorders, there's a place here for ensuring that desk-based and office-based roles are set up correctly, especially with the current situation in which many of us are working from home and not in our usual working environment. Providing space and opportunity for physical activity and encouraging individuals to move more during the working day can reduce the risk of this as well. It's also likely that the mental health stats that are shown on the slide are exacerbated by the COVID-19 pandemic. There's increased levels of uncertainty and anxiousness amongst individuals and businesses. And whilst you can see on the left there that workplace absences have fallen, but mental health days lost due to mental health related reasons have risen over the last sort of decade. Most common reasons for this are sort of workload pressures, such as tight deadlines, but also a lack of managerial support. In terms of sector-specific data, we find that stress, depression, and anxiety is most prevalent in public service industries, such as education, health, social care and defence, and probably more so at the current situation where a lot of these sectors are sort of at the front line of the response to the COVID pandemic. So Public Health England developed a few infographics a couple of years ago now that support sort of the insight into health and work. This one looks specifically at a spotlight on mental health. But in the top left, you can see that almost 1 in 6 people are estimated to have a diagnosable mental health condition. But interestingly as well, those with physical long-term health conditions, 1 in 3 of them also have mental illness. So you can see that comorbidity there with the two conditions. And the benefits of workplace wellbeing are far-reaching, and whilst they can support the individual, they also have great benefits for the organisation level as well. So just looking at them briefly, and you can read all of them on the slide, but at an individual level, we see that health risks are reduced, health status is improved, see a reduction in stress levels, greater job satisfaction when we value staff health and wellbeing. And at an organisation level, we see a reduction in costs associated with things like sickness absence, staff turnover, greater retention of staff, and a better team morale across the workforce.
Thanks, Bryony. That was brilliant. And we are on schedule, which is amazing. So well done. So we're really lucky today because what we wanted to do is make the session as interactive as possible, even though we're on a webinar. And we're really lucky that we've got Lucy Robinson from the East Midlands Chamber of Commerce to talk to us and answer some questions for us today, alongside Lauren Stacey, who works with Inspired to Care as part of the County Council liaising with the social care and health sector, who we all know have been a massive part of the support network for the situation that's continuing to unfold. So we've got some questions for Lucy and Lauren. So Lucy, I wonder if you could kick us off. If you could tell us about the benefits from your perspective for businesses and employers if they're looking at health and wellbeing of their workforce.
Yeah, of course. I mean, I can talk from, I suppose, our personal perspective as a business, but also those SMEs, mainly SMEs that we tend to work with as a Chamber of Commerce anyway. I know that across the board, they do see the reduced levels of sickness absence. But I think one of the biggest things, and I think you touched on it on one of the slides, was just around presenteeism as well. The fact that actually through workplace of health and wellbeing, it actually doesn't eliminate completely the presenteeism where people are obviously there but not actually able to focus or get the best out of themselves. I know CIPD said that it's costing absence costs are around £554 per employee every year, but the data suggests that actually presenteeism costs the economy a lot more. It's estimated in 2009 that was potentially £91.9 billion that it costs the economy. Due to lack of productivity, ill health, those types of things, where people obviously are still turning up for work, but obviously have underlying issues. I think it was interesting as well, and I nearly typed it into the chat actually. I think one of the reasons we may start to see, and again, companies that I've spoken to that actually put health and wellbeing, especially mental health as well, at the top of their agenda, find that people are more open. So actually they're recording more honestly the reasons they're actually off sick in the first place. What that allows the organisation to do is actually tackle problems properly, rather than it appearing to be a stomach bug or a cold or something that they may have previously logged as being the issue. And the two things may be related. You know, we all get stressed. You may end up with stomach sort of problems, those types of things. It's a knock-on impact. But they were more likely in the past potentially to have recorded it as the physical issue rather than the mental issue. Whereas if you get people recording honestly, you can actually tackle it. And again, for ourselves and also other organisations that I've spoken to, that they've found actually having those real reasons for absences has allowed them to support their employees better, which again has then reduced the amount of sick days. And again, maybe that sort of presenteeism sort of issue where they've got people turning up for work but aren't really fit to work. I think recruitment and retention is quite a big point around sort of wellbeing, health and wellbeing as well. If you're supportive as an organisation, I think that pays dividends. You know, there's a lot of social media out there, so employees can be putting things on social media. You've got Glassdoor and the other sort of ratings for sort of organisations. So as somebody's looking to move jobs, they could be doing their research on your organisation. And obviously, if you've got things that are online that are not necessarily in your favour, where somebody may have been, I don't know, pushed out the door because they've got a mental health issue, for instance, instead of feeling supported, again, at some point that could come back around. So I think you have to think about the external impacts that potentially not supporting health and wellbeing could have as well. You've obviously got engagement and productivity. Now, we've, over the last sort of 5 years, put lots of different things in place. And by that, I don't mean, I know there's a bit sort of more conversation around what you can do, sort of best practice. It doesn't have to cost a fortune. Again, a lot of the smaller organisations that I'm speaking to are concerned that actually by trying to do some of these things, it might end up costing them quite a lot of money. And it doesn't. And I suppose that's where some of the support from LRS really sort of comes in. There's lots of schemes available, even if you're not in the Leicestershire sort of area, that could potentially support you and your workforce in working through what you can do to implement things that will really help you. So I think don't let cost be one of the barriers potentially for sort of moving this forwards. I think it's really, really important to see the return on investment for it really as well. Even if it takes a little bit of time to do certain things, the return on investment's massive in comparison. We have seen, and again, sort of spoken to other organisations, they've seen improved focus at work. better engagement, reduced stress levels, people actually feeling really positive about their jobs and really happy doing their jobs and having a good positive outlook. The physically healthier and improved general sort of well-being, they can see that through their employees, especially where they might be doing, I mean, again, we do these types of things. We have little step challenges. It gets everybody involved, everybody talking. Then we might have a little team meeting where we're talking about it and sort of making a joke about, you know, how many steps we can get in and how somebody has actually managed to get so high, etc. But it's just increasing sort of people's consciousness of getting up from your desk and moving, especially now we're all potentially either working at home or working more virtually. I know for instance, I'm in the car less, but that means I'm having less stops between meetings where I might get up and I might be walking from here to somewhere else to attend a meeting. So I'm sat down a lot longer. So actually making sure I take that break is really, really important. And I think trying to just do those simple things with your employees is something that doesn't cost you anything. And actually when they come back, they're more focused. They're having better relationships with colleagues and managers, and generally they're sort of not butting heads with people as much because they're not in that frame of mind where they feel that potentially that they've got that level of anxiety where they might be thinking that not the world's against them, but other things are sort of going on and they're potentially worried. And actually that's having, and these are from people that I'm then speaking to at organisations that are doing more around health and wellbeing, they're actually finding that their external life relationships are improved and they're generally feeling better and more positive just in general. And I think that is something obviously we all need to try and do, especially during these times.
Thanks, Lucy. That was really insightful, really broad perspective. And the Chamber of Commerce is obviously an employer in its own right as a large organisation, but actually works with an enormous number of businesses. So that was really, really helpful. Lauren, I wonder if you could just sort of build on that picture for us, looking at the social care and health sector. Obviously, Lucy's covered quite a lot of ground there, but things that are perhaps slightly different or relevant to your area of work.
Sorry, right on cue, my cat's come onto camera. Yeah, so my name's Lauren, I work with Inspired Care. So we work with around over 150 social care businesses, charities, organisations of all different sizes across Leicestershire that provide adult social care services. Health and wellbeing is a huge topic in the sector at the moment as a result of the pandemic and the huge impact that that's had on all of the organisations, all of the services that we work with. It's a topic that is coming up a lot. We do one-to-one recruitment and retention sort of support meetings with managers, and this topic of supporting health and wellbeing is becoming increasingly one of the top issues that we hear about. Health and wellbeing impacts on every element of the service. So it impacts, as Lucy sort of alluded to, kind of staff absences. So we do see increases in staff absences due to mental health conditions, but also lots of other health and wellbeing issues, and also staff turnover. So in the adult social care sector, we have an above average staff turnover rate. And that's definitely one of the evidence shows that sort of well-being and health issues is one of the reasons why that is so high. So it's really, really important that as a sector we work to help improve health and well-being, and it's something that managers and businesses are really keen to get on top of, really. The benefits of taking a really strategic approach to health and well-being have been really well recorded, and anecdotally, even since the time we got involved with LLR Sport and sort of spreading the word to our members about the wellbeing resources. Already we're hearing from organisations about how it's helping them just to have a really strategic approach to helping their staff, and that has loads of benefits in terms of reducing that turnover, helping staff to stay well, about how to sort of help staff deal with the immense pressures that they're under at the moment, And also, as Lucy said, in terms of recruitment, so we do look at that, and having that really clear message that we value the health and well-being of our staff as much as we do the people who use our services is really, really important. And I think it's prompting those conversations across the sector about how do we talk to our staff about these issues, how do we support them, whether that's to do with anxieties that they're facing, stress, or physical health. Obviously a lot of the jobs in adult social care are very active roles. Unlike desk jobs, they're kind of often the opposite of that. So staff working in adult social care are generally on their feet all day, out and about doing moving and handling, and then on top of that, obviously you've got the emotional strain that some of the roles, well, most of the roles in adult social care will take. So it's starting really important conversations within services about how do we best support our staff, and getting that conversation going, but in a very strategic way of how can we do this in a way that's going to be the most effective. Lucy mentioned a little bit about barriers, and I think we're going to come on to that, but time, and I'm sure I don't need to explain that the pressures on the adult social care sector at the moment are huge, and time is a huge issue, and sort of lack of sort of time resource. So anything that can be really simple and clear and strategic in that way is really, really valuable for our members. But yeah, the research also shows that better health and well-being of staff leads to better care for the people who use our services, which is ultimately all of our aim. Anyone who works in adult social care, that's what we're passionate about, the people who use the services and delivering the best care that we can. And all the research and anecdotally points to the fact that if your staff feel well and feel looked after and protected in their role, and have a really good support network around them, then that is going to pass on to the people that they're supporting. So we're really sort of trying to get that message across to businesses and helping them really to implement really good, effective strategies for them to best support their care staff. And ultimately that's going to lead to lots of benefits across the sector.
That's brilliant. You've both covered so much ground. That's just amazing. I mean, Lucy, I don't know if you've got just anything else to add based on sort of thinking about the barriers to employers, and Lauren's touched on a few there around time and pressure, but then the outcome is in the social care and health might be better care, and other sectors it might be something different. Is there anything else you want to add around what the barriers for employers might be and how we overcome them? But we only have a minute or two, so
yeah, no, I think again it's that whole thing around people thinking it takes a lot of time, but it obviously takes a lot of time to manage absence and productivity and other things. So you've got to weigh the two up and see, obviously, I think tracking that within your business and then trying to take a comparable 6 months, a year later would be really interesting. You'll start to see that return on investment, and it is there. We've seen it, and other organisations that I've spoken to see it all of the time. I think in terms of outputs, again, if people are happier, generally, it's been proven that customer service is better, and that's, whether they're looking after other people in the care sector, or whether it's, working with other businesses, with other people, those types of things, the relationships in general sort of improve. And again, that's a massive impact for you as a business, because you're going to potentially retain and keep businesses or people coming back to you. So in terms of longevity for your business, it's potentially really, really beneficial.
That's brilliant, Lucy. Thanks for that. Lauren, is there anything else that you want to add to that?
Yeah, I mean, I think when we first started talking to our members about health and wellbeing strategies, certainly time was a big one that came up. There's already so many different pressures being placed on managers and business owners in the sector at the moment. So I think there was that fear, but we were actually able to quite quickly sort of reassure people in that way. Certainly with the support that you guys provide with that, we were able to sort of we always talk about the most effective way of sort of doing things. But I think the point that Lucy made is really important it's about prioritizing and preventative. So it's about, if you put these things in place, it will take a bit of time, but then it's about talking about the benefits in the long term, and the time that as a sector we spend on having to recruit and it's about sort of putting this in now and then sort of seeing the long-term impact that that's going to have. And we do encourage the use of return on investment trackers, turnover trackers in the sector, so that people can really track what they're implementing to check that it is actually working for them. I think one of the other things that has come up is often organisations that we work for might have quite complex sort of organisational structures. So they might have multiple care homes, for example, that are owned by an umbrella organisation, but they're in different areas and they all look slightly different. So that's some of the questions we're getting about how do we sort of come up with a strategy that sort of takes into consideration all of that. So I think that can be a challenge. But again, it's just about starting off small, working and seeing what's going to be most effective and sort of building up from there. And another one just to mention is digital skills. That's something that we do come up again sometimes, that people might struggle with sort of online resources, and not a lot, you know, there are lots of staff working in social care that maybe don't have access to like a laptop or just use their phone. And so it's about kind of being creative and sort of thinking, how can we communicate these messages? How can we get through to staff in the best way for them? So that's certainly a consideration that we have, because the staff that we work with don't tend to sit on a laptop all day or have a work email necessarily, because they're out and about, often lone working. So the kind of communication structures can be very different depending on the type of service. So that's something that could be a barrier, but again, I think it's something we can overcome. It's just about being creative and always talking to staff. I think that's it. We always say start by chatting to staff, so encouraging things like staff questionnaires and open conversations and dialogues where staff can say, this is the best way to communicate, this is the support I need, and then sort of tracking it and going from there.
That's brilliant. You guys have covered an awful lot of ground for us, which has been hugely useful. We have to say thank you and goodbye to Lucy now, because she's got to head off. But thank you, Lucy, because that's really, really useful. I think you've covered an awful lot of topics and made it relevant to the audience. So thank you very much. And I hope as listeners that there were snippets in there that you could relate to and perhaps translate into your organisation, how that might work for you. We're going to press on, because I think there was a huge amount there about the value of preventative measures and implementing there. And I think Bryony's going to talk us through some of the options available and how that might work. Can you see that, Bryony? Oh,
No, not yet.
You can't see it?
No, don't know if it's just me though.
Can everybody else still see the screen? I'm getting nods.
Just see the Q&A.
Do you want to, shall I kick off then? I think others can see it. Oh, now I've lost Bryony.
I'm back. Don't know where I went, but I'm back.
Okay, can you see the charter screen?
Yeah.
Great.
Thank you, Ali. So we're just going to spend the next few slides talking through the Wellbeing at Work programme delivered by Leicester-Shire and Rutland Sport, and how we can support your workplaces to overcome some of the issues that we've talked about on the previous slides. So the Wellbeing at Work Charter was launched back at the start of October, and it was to supplement our existing Wellbeing at Work offer for local workplaces. The Charter is a local accreditation scheme to recognise the efforts of workplaces in Leicester, Leicestershire and Rutland in supporting the health and wellbeing of their employees, regardless of the sector that they work in or the size and type of their organisation. There's two accreditation levels, the pledge and the award, and we'll go into a bit more detail on them on the next few slides, but it's also underpinned by a tool called the Workplace Health Needs Assessment, and also the Wellbeing at Work support package. And both of these are optional, but can sort of support the criteria of both the pledge and the award if you're aiming to work towards them. So the first step involves making a free pledge to demonstrate your commitment to employee health and wellbeing, and you can do so in 3 easy steps. You can see them over on the right, but all we ask is that you appoint a dedicated health and wellbeing coordinator, and you might have someone in place already who does this role either formally or informally. Want you to be able to demonstrate buy-in from either your senior leadership team or senior management. and then be willing to promote public health messages that encourage healthy lifestyles amongst staff. And we've got some great resources that you can access by signing the pledge to be able to help you to do this. It's a free option to sign, completely voluntary, but you'll receive recognition from LRS for your efforts, and as I said, a link to a free resource library as well. Step 2 involves the workplace health needs assessment, which, as I mentioned, is a tool developed by Public Health England to identify key priority areas of staff health and wellbeing. It allows you to provide an offer that's sort of bespoke to the needs and values of your staff, and that can really ensure better engagement with any interventions or activities that you put in place if you know that it's related to the specific needs of your organisation. So it's a 3-step process, and a lot of the work is done from LRS side of things. So there's a lot less work involved from your point of view. But what we ask is that employees complete the needs assessment using a link provided by LRS. Takes around 10 to 15 minutes for each individual to complete it. And once they have, we then download all of that data and produce a comprehensive report for you. And within this, you get tailored recommendations that include sort of national and local opportunities to better the results that come out of that survey. We can then support you to go through those results and produce a health and wellbeing strategy, or begin developing an action plan that tackles some of those issues identified within the report. Just importantly on this, I think it's by spending time sort of on the right things for your team, you're investing to achieve specific outcomes. So by knowing the priorities within your organisation, you know where to sort of focus your efforts and in your investment in supporting them. The only job for you, as we said, is sharing that link and encouraging a good response from your staff. We do all the analysis for you and produce that report, and then it's just down to you then to drive that action plan or strategy moving forward. And again, that's something we can support with. So optional step 3 is to sign up to the award, and this is awarded to organisations who can demonstrate implementation of the pledge, but also provide evidence of the delivery of health and wellbeing interventions. So you'll complete the needs assessment within this, or if you have done another recognised sort of needs analysis tool, then you can use that. Consultation session with us to sort of look at your priorities and start to develop that health and wellbeing action plan, and then submitting that evidence of delivery of interventions. And this will be bespoke to the needs of your organisation, but it could be anything from mental health policies, exercise classes for staff, travel plans, infrastructure, and lots of other opportunities. So just so you can see sort of how the charter flows, obviously it starts with the pledge and then you have the optional steps following that. But for each accreditation level, you get a badge and a certificate and access to our resource library and support package. You can see there what you get for each accreditation. And all of our information is in our charter guidance document, which we'll share with all delegates after the meeting today. So on the slide now, you can just see the pricing structure for our charter. The pledge, as I mentioned, is completely free to sign, and you get that recognition there for making that first commitment. And then the price is on there for the award and the needs assessment. The award price is inclusive of the needs assessment, so if you haven't already completed one, you only need to look at the price of that award, and that includes completing the needs assessment within that. So just another poll for you now. Just want you to answer with a yes or no as to whether you know where to find resources to help you promote those positive public health messages to staff. So just a yes, no, or if you're unsure. Okay. So a bit of a mixed bag. We've got about 44% saying yes, they do know, and then a few unsures and no's as well. So there are loads and loads of resources available, and we won't go through every one, but I've put some examples here up on the slide of some of the things that are included in our employer resource library. So once you sign the pledge and you've got access to that, you can find all these useful links to support you to promote the right messages to staff. There's a few on there that are specific to sort of mental health. You can see your mental health first aid training over on the left. Mental health at work and mind both provide some great resources for supporting staff mental wellbeing. Some physical activity specific campaigns on there delivered by LRS. So our Active Together campaign and our Make Your Move resources around supporting people to be active in their local area and from their doorstep. Business in the Community has some really great toolkits for all areas of health and wellbeing, from alcohol to smoking, mental wellbeing and the menopause. So they've got some really good useful and practical ways of bringing up conversations around those issues with staff. And then there's some public health campaigns on there too. So One You and Better Health, again, look at health in the broader sense, but Better Health specifically is looking at how we can support people to look after their health as we sort of recover from the pandemic, but also in terms of supporting people to look after their health and provide them with the ability to sort of overcome COVID if they do catch COVID. So we're going to go into our next Q&A now. So I'll introduce Gemma Abel-White. Gemma is the Listening into Action and Health and Wellbeing Lead at Leicester-Shire Partnership Trust. LPT employ around 6,000, 7,000 staff, I think it is, Gemma. And we've worked with them quite closely on our Wellbeing at Work package. So I know LPT have done the needs assessment around a year ago now. But hopefully, Gemma, firstly, if you could just give us an insight into any challenges arising in your sector and sort of why you feel it's important to look after staff wellbeing at this time.
Yeah, I mean, challenge-wise, it's been a completely different way for many of us working. So we've had the challenges of getting information and resources out to staff. That's been one of the major challenges, and knowing how to help people to access that. Also around people's capacity. So we've got people working on the wards in community, their capacity to access things. We've tried putting things on at different times during work hours, outside of work hours, and I'll talk a little bit more about what has and hasn't worked later on. But the challenges of keeping people well at work at the moment are huge. And yeah, it's been about providing information emotionally to help them emotionally, but also physically. So there's demands in both areas for them. And as Lauren said a little while ago, we know that the importance of keeping our staff well has a massive impact on providing care. We need to keep them well as individuals, but also as our organisation. We can't let the NHS crash. We need people to be well to provide that care.
Brilliant, thank you, Gemma. And what sort of interventions and activities have you put in place, and what do you think's worked well and what perhaps hasn't?
Yeah, so we already had a health and wellbeing calendar with monthly topics, and I think when we were talking about it doesn't have to cost a lot of money, we've implemented things that haven't costed any money, and one of those things I think is a starting point has been the health and wellbeing calendar, so with topics for each month, and within that we provide a newsletter. So the health and wellbeing team at LPT is me and an assistant. So we put together a monthly newsletter relating to the topic for that month. And then we send that out to our health and wellbeing champions. We've now got 200 health and wellbeing champions across our organisation. And this is one of the ways that we've overcome the challenge of getting information out. If we send information to them, then I ask them to share it with their team however they can. So it might be, well, in the old days, it might have been a display board, or, at team meetings. Things are changing rapidly now. The team meetings are on Zoom, but those things haven't cost anything. The workplace health needs assessment was really helpful in helping us get the topics right for each month. So we'd got some topics that just weren't really hitting it. And once we did the work needs assessment, we realised that actually there was a massive need for information and resources to be sent to staff around sleep. So we hadn't thought about that at all. So now we've put that in as a month. So there's resources that people can access around the topic of sleep is just one of the 12, obviously. All the resources and the newsletters that we send out are also put on our staff intranet, so people can go back and access these resources if they need to. Another thing that's worked really well, I think, that as the health and wellbeing lead during COVID from March, April time, I realised that there was an absolute flood of information coming, and I was feeling overwhelmed, and I didn't have an extra job to do to sift out what was relevant. So I've now put together a presentation, and I'm going out to team leads, just pulling out information from 1U sites, from Public Health England, what resources are available, helplines through the NHS, the 24-hour helplines, the text services, and then more local services from us. So we've set up some mindfulness classes, some drop-in sessions that people can access. We've got another thing that was really successful was we call them Leading Together bite-sized sessions, and they run every week, and they're just a half-hour session, and they have a really strong health and wellbeing topic to them. So it might be around DSE, it might be about disabilities. I've done my health and wellbeing presentation there, but they're really popular with staff, and that in making it half an hour within work time, it seems to be much more accessible for staff than having a whole hour. So it's the bite size that makes it accessible for staff, I think.
Brilliant. And you did a virtual health and wellbeing festival a couple of weeks ago, didn't you?
That, yeah. So we did an LLR system-wide health and wellbeing festival at the end of October. And that was great to see all our partners coming together, providing different topics of information. We had someone talking about their heart. We had emotional resilience, some mindfulness sessions, Zumba, yoga. That was another great way of engaging staff, of making things available, and we've kept those recordings so that people can go back and see those. And again, we really tried to keep all the sessions to around half an hour, because we knew that staff were saying to be able to access health and wellbeing initiatives was a real struggle for them.
And that just shows that it was an option to be able to deliver something despite not being able to be all together, and there are ways to overcome that, weren't there? And I think you've got really good engagement with that, which is great.
Yeah.
Thank you, Gemma. Do you have any more questions for Gemma, Ali, or should we move on? That's great. Thank you, Gemma.
Thank you.
Are you there, Bryony?
Yeah, are you all right to take this bit, or was it?
Yeah, that's fine. Yeah. Sorry, I had a problem with my microphone there.
Right.
I don't know about anybody else, but I'm quite inspired by all the speakers. Actually, we've covered a lot of ground about management things, as well as the practical issues of the topics and how that all works. So that's a real help. Bear with me, I'm having a screen issue. Okay, so we wanted to take the first step and consider what the pledge means, and make good use of the time this morning to really explore that. There we go. So Bryony did mention earlier the steps for the pledge. So we wanted to talk about getting ready to sign the pledge, and we just wanted to use the time this morning for you guys to think through the session. So one of the first steps of signing the pledge would be appointing a dedicated health and wellbeing coordinator. And so just take a moment now to think, do you already have someone who's doing this role formally or informally in your organisation? And think who might be the ideal person within your team to take that on. You don't need to say it out loud. You can share points in the chat, or you can just make a note to yourself that actually I think these 1, 2, 3 people might be the first people to talk to. Okay, and then the next step on signing the pledge would be demonstrating management buy-in. And you may be the decision maker on the call today, but you may be the person who passes the information on for someone else to make the decision. So who would be best to take that to your senior leadership team or your senior management team, and have a think now about what might be the carrot that's the most motivating for them at the moment. And only you would know that because it's your organisation. We've talked about things that are relevant to the speakers today. Bronnie, are you watching the chat? Great. Okay, so hopefully that's just a moment there to think about that. And then one of the big challenges, I think we talked about it, a few people have mentioned it actually, around communicating with your team. Now, if your team are based behind a computer, that you might have one method of communication. If your team are based across a hospital or care homes or wherever else, that might be something different. But just take a moment now to think about how is the best way, or what is the best way to communicate health messaging to your team. And perhaps there'll be more than one. There would likely be several ways that you could do that. And sometimes the benefits of these sessions is actually we've got some incredible brains all in one place at the same time. So if you wanted to pose a question in the chat for others, you can do. So this is just an example here of some of the organisations who have signed the pledge and the statements they've made about why. I'll be quiet and let you have a little read of those. So I believe we've had around 50 employers sign the pledge, all with similar but slightly different slants on what's motivating them and why they're prioritising the health and wellbeing of their workforce. But if you need some helpful support, you would find that on there. If you need that to take to your senior leadership team to help inspire others to find the most important thing for them at this time. So what would be the benefits of committing to support the health and wellbeing of your workforce or organisation? Bronnie, I can't see the chat at the same time as doing the slides. Are you okay to pick up on anything? Yeah.
Yeah, feel free to put your comments in the chat and we'll feed that back to the whole group.
I mean, we've heard some brilliant things from Gemma, Lauren and Lucy this morning around the benefits for them. But I think what's most important is what's the benefit to your organisation and what's going to make that really valuable to you. And perhaps that's about managing the managers' stress levels at a time when we've had a very strange year. But that will be different for all of you. And if you've got any cracking snippets, please do share them, because what you say in the chat might be just the thing that one of the colleagues on the call here can utilise within their team.
We've got one comment just to say that it's the sense of staff feeling cared for, particularly at this time. So that's one benefit for one organisation.
That's brilliant. And I think one of the things that that Gemma touched on was sleep was a topic that you hadn't thought of before. And actually what Bronnie and I have heard from feedback from other employers who've looked at health and wellbeing of the workforce is this sort of process, if you like, has given them tools to engage in conversations around health and wellbeing, around perhaps the menopause or cancer, or topics that are quite difficult to raise actually. But if you're doing it with the tools that are available in a way that's right across an organisation, it becomes much, much easier. And what might be the challenges for you? And use this time now to share what those challenges are, because somebody on the call might have a cracking solution to that challenge. Bronnie, have we got any more coming through the chat?
Noel has just mentioned that keeping colleagues connected and avoiding social isolation is really important. Comment around how useful a sleep resource might be. So again, we can sort of signpost to some of those resources that are available following the session.
That's brilliant. And so obviously if you've got specific challenges you're looking at, is how do we work to overcome those? I think we've probably covered that in what we've talked about already.
Got another challenge sort of around convincing line managers as well to buy into the offer for staff.
I think that was a really honest point that whoever's put that forward. And I think if we go back to some of the things that Lucy and Stacey raised, you've got to look at it from perhaps that person, the manager's viewpoint of what it is. Why is it that they're seeing that as another barrier? And is it the time? Is it the concern? And you've got to think about what the solution, what solutions this might give them that's relevant to their frame of reference. So perhaps it's about finding tools that make the task much more manageable. It's not a big thing to bite off. Perhaps it's about utilising the skills that are already in your workplace and making the most of the resources available. But Bryony and I can have individual conversations with you afterwards if that's useful. Okay, so we wanted to take some time today. Bryony, did you have anything else you wanted to add before I jump onto this?
No, go ahead.
So we appreciate that you've sat and listened to a various amount of people for about an hour now, and we wanted to give you guys the chance to have your voice and share some discussion. So what we wanted to do is break into 2 breakout rooms. There's no real theory around that, but in a moment Bryony's going to try to send us all to a different breakout room, and we're going to just talk through these points. Tell us what's motivating you to implement this type of approach at the moment, and what do you think might be one of the first benefits for your organisation. So Bryony's going to send us into the room. I'll just be honest about the timings now. So we're going to be in the rooms till 11:15. We are going to finish promptly today because it is Remembrance Day, and it's important that we're all free just before 11. So we will stick to timings if that's okay. So Bryony, I'll let you send us to the rooms and cross your fingers. We'll pop out the other side.
I've set it at 10 minutes in the rooms. Do you think we need a bit more?
I'll probably allow a little bit more time now.
Right, hopefully everyone will go to the right room and then they'll come back after 15 minutes and we'll all be back together. So we've just got one last poll before we finish, and the question is, are you ready, or do you think you're ready to sign the Wellbeing at Work pledge? And you might not be, or it might not be your you might need to go back and talk to colleagues around your next steps, but just to give us an idea of how ready you are, just answer this one for us. Okay, I think that's nearly everyone. So yeah, that's good. We've got a few that are ready. So what we'll do is, following this workshop, we'll send out all the information that we've shared today and a copy of the slides as well. And you'll be able to find all the links that you need to sort of take those next steps, regardless of whether that's just signing the pledge or going and finding out a little bit more information. And feel free to come to me or Ali for a bit more information about anything that we've talked about today. So it's just a thank you from us, really. On the next slide. So a big thank you to our guest speakers today that participated in the Q&A. So Lauren and Gemma, I know Lucy's not with us anymore, but I think the conversations that have come out of that have been really useful. So thank you for being here today. We will stop the recording now. The copy of the recording will be available on the LRS website under the conference page, alongside recordings of all the other workshops. So if you haven't had a chance, go over and have a look at all the other workshops that are available, and you'll be able to catch up on the recordings after today. Please complete our evaluation survey if you can, just using the link that's on the slide. If you registered through the Leicester Business Festival, I think you will also receive an email from the team over there, just with a separate evaluation link. So if you can make sure you can complete that for us too. Just finally, we're looking to set up a mental health, sport and physical activity network. So if you're interested, then please come to the workshop on the 30th of November. Details will be on the conference page of our website, or fill out the relevant section in the evaluation form, or email LRS, and we can give you more information about that. So mine and Ali's contact details are just on the last slide. So if you want to get in touch with either me or Ali, please feel free to, and we can give you some more information and answer any questions that you might have. But thank you very much for attending this morning, and I hope you have a good rest of your day.